I'm Kaylee from Cratus Medical, and I'm here to talk about hormone replacement therapy. Bioidentical hormone replacement therapy is very safe. So in comparison to synthetic hormone replacement, synthetic hormones are kind of what people traditionally think about when they think about hormones. They are things that cause, cancers, heart attacks, strokes, a bunch of things that we don't want. So we use bioidentical hormones, and those are actually protective against most of those things. You could be a good fit for bioidentical hormone replacement therapy if you notice that your energy levels are decreased, if you're having a hard time losing fat or building muscle, if you have a decreased sex drive, or if you're having a big lack of motivation. Normally when people come in for a bioidentical hormone replacement therapy, we draw their blood, send it to our lab. The results come back in a day or two, and then we go through a full consultation with a list of kind of questions and symptoms you might be experiencing, and we kind of match that to your blood work. So then we can go through and figure out which hormones you're deficient in and what we can replace. So when we're seeing people for hormone replacement therapy, our goals are really to make the patient feel better. So we base our doses and our kind of response to the treatment based on the patient response and the lab levels. Normal levels and optimal levels are different. So someone can be technically in the normal range but experiencing symptoms. So our goal at that point is to get them to their optimal goal. If you have any other questions about bioidentical hormone replacement therapy, feel free to give our office a call and we can answer any questions you have.